Good morning, everyone. Thank you for joining me today. We are going to talk about something that seems simple but is really often underestimated, which is manual handling. Many of us do it every day, including a lot of sectors as well. For example, by lifting a box, moving supplies, pushing a trolley, but when done incorrectly, it can lead to serious injury. Our focus today will be understand the risks associated with hazardous manual handling, why it matters for our safety, and most importantly, how can we prevent injuries by applying proper technique and controls. So moving on to our second slides, what is manual handling? Let's start with the basics. So what exactly is manual handling? Manual handling includes any activity where we use our body to lift, lower, carry, push, pull, and hold or move something. This might be lifting heavy stock in the warehouse, assisting patient in the hospital, or unloading equipment on a construction site. It parts of many everyday tasks, and while it might not seem dangerous, manual handling is one of the leading causes of workplace injuries. That's why understanding how to do it safely is critical for both workers and employees. Let's moving on to the next slides. Now, not all manual handling is hazardous, but many tasks become hazardous due to certain risk factors. For example, a task is considered hazardous when it involves heavy or bulk loads, repetitive action like stacking shelf all the day, awkward posture such as bending or twisting while you're lifting, or high or sudden force such as catching a falling object from high, or prolonged handling like holding a tool for hours without a break. These factors put strain on our muscle, joint, especially in the back, shoulder, and neck. When the worker or someone done repeatedly or incorrectly, the risk of injury increase significantly. Moving on to the next slide. So, what kinds of injuries are we talking about? So basically, the most common one injuries include back pain, sprain and strain to muscle, and your shoulder injuries, often from overhead lifting, or something that caused by lifting heavy or awkward loads. So according to Safe Work Australia, manual handling injuries account for more than 1/3 of all workplace injuries. This is a huge number. And the costs are just as high, not only in dollars, but in, of course, in time, productivity, and health. That's why prevention is very important. So to prevent hazardous manual handling injuries, workplaces need to follow a systematic approach. This includes 3 key steps, which is identify the task, assess the risk, and control the risk. So the control measures include eliminating the task altogether, if possible, or substituting heavy manual handling with mechanical aid. For example, use trolley or lifting device, or redesigning the task, or maybe having a team lifting, and of course, provide training to workers or contractor on how to use safe technique in their workplace accordingly. So this approach follows the hierarchy of control, aiming to eliminate risk at the source before relying on training or personal effort alone. Moving on to the 6th page. So even with all those control measures in place, there will still be times when manual handling is required. Here are some safe manual handling tips to reduce your risk of injury. For example, you have to observe and plan the lift first, know what are you going to do, and observe your surrounding, and test the weight before you leave your workload. And get close to load, bend your knees, not your back, avoid twisting, and keep a stable posture, like the photo that I attach next to us. And these techniques might seem simple, but consistently applying them can make a very huge difference. Moving on to slide number 7. To wrap up, manual handling is a routine part of many jobs, but it's often underestimated. But tasks become hazard, they can lead to serious injury that affect not just productivity, but people's long-term health and well-being. We can reduce the risk by identifying the hazardous tasks, applying the proper control measure, using safe lifting techniques, and fostering a workplace culture that prioritizes health and safety. All right. Thank you for your attention. Now, I did like to open some question if we do. So feel free to comment anything or ask anything about my presentation below. Thank you for attending my presentation. That's it for today. Thanks, guys. Bye.